Deputy Governor, and also all our partners. Particularly today, we are also having a visiting professor from King's College London, Professor Lord Graham. As you know, the government is quite keen to tackle cancer as a scourge in the country. We currently have more than 29,000 people who die from cancer every year, 45,000 people who are diagnosed every year, more than 110,000 Kenyans currently are undergoing cancer treatment. We have a big challenge when it comes to cancer response. We have 6 cancer centers in the entire country, as you know, that are government-led. Recently, you saw 2 days ago, we were assisting county governments of Nakuru, Garissa, Mombasa to also manage their cancer centers, because we as a national government, under the leadership of His Excellency the President, are quite keen to ensure that the problems that are affecting Kenyans are sorted out when it comes to health. And cancer becomes a big problem for 2 reasons. One, it is that it is one of the reasons why many Kenyans die prematurely, but more painfully is the fact that even as we lose lives very prematurely, it is also quite costly in terms of the treatment, and so it also makes very many Kenyans poor. And so this institution is part of the response of the Kenyan government to ensure that we establish more cancer centers in the country. This is a national government project that we are doing. It has been conceptualized for a very long time. It had taken time off, and late last year we began this project. As you can see, it is progressing very well. We want the contractor to ensure that this project is completed by the end of this year, and that is the direction and the directive that His Excellency the President, Dr. William Ruto, has given us to ensure that this project is completed, so that it is responding to the needs of cancer in this region. As you know, we are having a huge cancer burden in this region: cervical cancer, breast cancer, colorectal cancer, esophageal cancer, and all of this, sometimes, of course, many people go to the neighboring Kenwe. Many people, as you know, go to MTRH. A lot of other people have to suffer in the buses in the night to go to Kenyatta National Hospital, and part of the decongestion is this. And from that perspective, we are also making sure that we pay for cancer care. As you know, we increased the package in the Social Health Authority so that we can make it easy for people to access care without financial burden. And we are keen to even make sure that that cost is reduced. You know that we have MOUs, that is Memorandum of Understanding, with even drug companies like Roche, where we have reduced the cost of breast cancer medicine from 120,000 to 38,000. This morning we were to meet with Pfizer again so that we reduce the cost of the medicines, because sometimes we say that we are paying 550,000 from Social Health Authority. Some people still say, oh, this is not enough. But we know from a government perspective that those medicines can be less costly. That is also an intervention that we are making. We have more than 140 molecules across the board, prostate cancer, that we want to make sure that we reduce the cost by more than 60%. And we make sure that all these our cancer centers are working. And today, the reason why we are also visiting with King's College London is because once we build the center, once the government has set up the Social Health Authority to pay, once we have signed up with the drug companies to ensure that the cost is reduced, we must have the healthcare worker who is properly trained to do it, and that's the partnership that we have. So we are keen to ensure that this project is completed on time, it's completed on budget, and to standard, and it becomes an example and a center of excellence for the entire Africa. Thank you so much. I would like to also appreciate my colleague, PS Dr. Steve Isaboke, who is the PS for Broadcasting and Telecoms, who in the spirit of whole government approach has also accompanied us to tour this project. And at this point, I would like to welcome him also to give his remarks. Thank you.
And also, members of Kisii County and the country. Like the PS colleague has said, my name is Isaboke. I'm responsible for broadcasting and telecoms, but I joined my colleague who is PS for health as part of the whole of government approach. The project behind us is actually a key component of the PETA plan. And as you know, one of the commitments that was made by the fifth administration of His Excellency the President, Dr. William Ruto, was actually universal health care. And for this region, there was a commitment to actually establish a cancer center of excellence, a cancer center for research that will then be used to actually help support our people. As you have heard from the medical practitioner himself, the PS for health, cancer is now becoming a pandemic with the high numbers affected across the villages and across the country. And it's actually a big blessing for Kisii County and this region of Western Kenya that we actually have a big center here. So for me, is to witness the progress. And as you know, when the president was actually in Kisii a few weeks ago, after launching Yota, dispersing money and all that, one of the things he committed on the roadside after the groundbreaking ceremony was actually the cancer center. He did commit that he's actually identified a contractor, and I'm sure Q, and I know him, that a proper contractor has been identified. There was one who was doing a lot of kitandawili before, that now this work has to be done and has to be finished, and that's why we're happy to see the contract on the ground, because of the commitment to deliver healthcare to our people. So really to say, we would like to see this among his other projects delivered, so that the services are delivered to our people, amongst many other commitments that the President and the government has made, so that we actually improve the quality of life of our people. I will speak more maybe in vernacular when the rest are done, but I actually want to say that, like my colleague said, we do get put into account and really put into strict delivery deadlines. And every time we're engaging the executive, from the president or a head of public service, is around delivery of projects, delivery of programs, delivery of what has been committed. And in this particular one, I was witness as well, actually when the Prime Minister was still alive. We again made a courtesy call on the President, and one of the things he raised as we were having breakfast before the address was Kisii Cancer Center. He knows the story, and he says, we will not allow any other kitandawili again. This thing must be complete. And hence, the reason why we've come out with government, actually make sure we support the President to deliver this project. I thank you.
My name is Professor Graham Lord, and I'm representing King's College London, but also the Kenya-UK Health Alliance, which was established by presidential mandate that has been supported by your current president. One of the very early missions that we had was, how do we help to address the problems of cancer care in Kenya? How do we deliver cancer care and research close to local people where it's most needed? So this is about my third or fourth time in Kisii County, and it's really exciting to see this whole of government approach to deliver fundamental cancer care delivery for the people of Kisii, so that they don't need to travel to other centres. And really, on behalf of the British government, working in partnership with the Kenyan government, very much one of our first projects was based here in Kisii County. In fact, much of the origination of the idea of the partnership came from Kisii County. So Kisii is very much at the centre of our envisioning for cancer care across the whole of the country. And I'm just here to help support, provide advice. We run a lot of cancer centres in the UK. I've built cancer centres before in the United Kingdom as well. So I'm just here to support and to make sure that the care that's delivered here is as good as anywhere in the world. So you can, if you live in Kisii County, you can come and get your treatment here, and it's the best treatment available anywhere. And I think if we do that and deliver that, then I'll be a very happy person to have worked in partnership with you, the Kisii County Government, the national government, and I applaud the words that both PSs have said about the government's commitment to seeing this project through to completion, and then critically making sure we have the highly skilled workforce to deliver the care and the research for all of the patients of Kisii County. So thank you very much for your very warm welcome as always, and I hope to be back very soon and seeing even further progress, and particularly when the hospital is opened and the first patients are treated. So please invite me to the opening and make the opening as soon as possible. Thank you.
Thank you.
Luga and your colleague Steve Isaboke. We want to thank you as a county government for coming today to come and witness what's happening here on the ground at this cancer center. And we believe your coming is a demonstration of the seriousness you have given this project. We know, as you have said, the cancer burden in terms of impact and cost is high, and the faster therefore this project is accomplished, the better. We believe once it's done, then the cost reduction in terms of disease will really come down and cost of treating the disease. We believe as a county government, we believe that you will get the job done and done in good time. We know that this is a serious project, the progress is good, but we want to request you, Dr. Oluga, that let it be done even faster, so that this burden we are talking about of cancer will soon be a thing of the past in terms of cost and impact. Generally, we would say we are happy and we believe the progress will be faster than it is now, so that we realize the completion of this project. Otherwise, thank you for coming, and we appreciate as a county government. On behalf of His Excellency the Governor, allow me to say a big thank you.
Thank you.